Thank you very much, Presiding Officer. Presiding Officer, first of all, I'm delighted to have secured this important members' debate, and I want to thank the many MSPs across the Chamber who have signed the motion. I also want to thank all those organisations who provided briefings for the debate: RNLB Scotland, Sight Scotland, Optometry Scotland, and also the RPP Group. As convener of the cross-party group on visual impairment, I every year try to highlight the importance of National Eye Health Week to raise awareness of the importance of looking after our eye health. But I don't just do it in 1 week a year. I do talk to constituents and do raise the issue throughout the year also. Since 2006, people in Scotland have been able to attend a free eye health check every 2 years, and it's vital that we all make use of this service, even if we think our eyesight is fine. That's because eye examinations not only help detect changes to the eyes before they affect vision, they can pick up on other health conditions such as high blood pressure, raised cholesterol, diabetes and increased risk of stroke. Therefore, going for your free eye examination every 2 years isn't just important for your eye health, but it's also important for your overall health. COVID-19 has made us all pay more attention to our physical and mental health, but worryingly, there were 4.3 million fewer eye appointments during the pandemic. That very much is understandable, but concerning at the same time. And COVID-19 has also resulted in increased waiting times for appointments, with many postponed, understandably, once again, due to the lockdown. Now, the longer patients wait to receive treatment, the more serious their eye condition is likely to become, which can also result in further deterioration of vision. Now, vital eye care has, however, been available throughout the pandemic at emergency eye care treatment centres and also through virtual appointments. Now, once restrictions were eased, optometrists offered routine eye health checks with measures in place to minimise the risk of spreading COVID-19. And at present, there are around 178,000 people in Scotland with sight loss, including almost 3,000 people in my constituency. Presiding Officer, that national figure is expected to double over the next 20 years. The most common cause of sight loss is age-related macular degeneration, but people of all ages can experience sight loss, and with the most common cause amongst working-age people being diabetic retinopathy. According to the RPP Group, in Scotland, glaucoma affects approximately 10% of those over the age of 75, or around 47,000 Scots, and only becomes more common and severe with increasing age. And glaucoma is also responsible for approximately 10% of UK blindness registrations. And so, considering that 50% of sight loss is avoidable, I cannot stress enough the importance of using the free eye examinations. I did this again this summer, and the experience was excellent once again. My message to Scotland is very, very simple. Now that the restrictions have eased greatly and optometrists are open for business, please pay that visit. Another way we can reduce our chance of developing sight loss and improving our overall health too is to quit smoking. I've never smoked, but I know that people who have both successfully quit, as well as others who have struggled to quit. Research shows that smokers are twice as likely to become visually impaired compared to non-smokers, as the chemicals in the cigarettes can affect the lenses and blood vessels in the eyes. Now, wearing sunglasses is also important to protecting your vision, and while sometimes we may have a joke about the Scottish weather and the Scottish summer, it doesn't need to be scorching hot and sunny for ultraviolet light to harm your cornea, retina and lenses. Eating a well-balanced diet is also important, as a diet rich in vitamins can preserve your eye health for longer. And Presiding Officer, National Eye Health Week is also about recognising the issues facing people already living with sight loss, and for them, the last 18 months has been additionally challenging. Sight Scotland asked over 400 people for their views on how they were impacted by coronavirus restrictions. And the main findings show that 70% said their sight loss had made lockdown an even harder experience, and 43% said they were still not confident about going back into society with social distancing requirements in place. How we emerge from the pandemic and what our recovery looks like has to be mindful of people living with sight loss. Additional outdoor seating and reconfiguration of public spaces and pavements is, of course, welcome, but we have to consider how this affects visually impaired people. These adaptations should seek to improve accessibility for everyone. They should not make navigating pavements, paths or parks more difficult for people who are visually impaired. Now, this is an issue that has come up in the cross-party group visual impairment in the past, which Ms Briggs is very much aware of. It's also important that we improve support and services available to people living with sight loss, as the latest research carried out once again by Sight Scotland showed that 55% of participants said they hadn't enough information about where they could find support after their diagnosis. And 83% said it was important to provide more support for family members and carers. In addition to that, 58% said they had not been made aware of financial support available to them. Now, I therefore welcome Sight Scotland's new national support line launched today by the Minister for visually impaired people to access advice and talk through concerns. That number is 0800 024 8973. The Sight Scotland support line is part of Sight Scotland's new family wellbeing service, which aims to reach everyone living with sight loss across Scotland. It's free and open 9 in the morning to 5 p.m, Monday to Friday, and a person can get in touch by telephone, email or by requesting a call back from an advisor. Also, RNIB Scotland offer advice and support by phoning their helpline on 030 123 99 99. And you can even ask Alexa to call their helpline without needing to touch your phone. They also have various other services and resources to help rebuild any lost confidence. I'm sorry that I can't attend the Optometrist Scotland webinar tomorrow entitled Future of Community Eye Care in Scotland, as I will be attending a funeral of a former MSP, Bruce McPhee. But I do encourage MSPs and their staff to log on and engage in that. I know that Optometrist Scotland work very well with the Scottish Government and encourage that engagement to continue. Presiding Officer, just to conclude, sight is the sense that most people say they fear losing the most. And taking care of your vision is a key. It is that very much key to prevention. So with that, I want to thank everyone once again for signing the motion so we can have the debate, and certainly look forward to other contributions from colleagues. Thank you very much.
Thank you, Ms McMillan.